Good morning. Today we are talking about diabetes and heart disease. So there are three things in this I want to mention. One is what are the problems of diabetic patients who can have issues about cardiac. Second one is how to treat. Third one is how to prevent. First of all, most of the diabetic patients will be having heart problem at one point of time, either after 5 years or 10 years or even after 25 years, even though they are taking a regular medicine for diabetes. The commonest cause of heart disease in India is diabetes. Second problem is what are the type of heart problem they can have. They can have chest pain and they can have breathing difficulty. Then they understand that there are multiple blocks. Or they can have a sudden heart attack. They may not be knowing only they are having heart disease, they can have sudden heart attack. And they can have sudden cardiac death. They may not be knowing that they are thinking that they are only diabetic patient, but they can suddenly die. That is because undiagnosed heart problem, silent heart problem, because they may not complain of pain much. They can have heart failure, they can have arrhythmias. Heart failure means they cannot walk, they have breathing difficulties, and their pumping will slowly come down over a period of years. The pumping will come down. It's called ischemic cardiomyopathy due to diabetes. So these multiple problems they can have, most of them will have at one point of time in their life. So how to treat it? The treating is very difficult, very challenging. So because if you do angioplasty, the stent may get again blocked after 3 to 5 years. So if you do bypass surgery, the recovery will be very stormy course for diabetic patients. If you give medications, only medicines, then also the disease progression will be very fast. Not only that, the vessels where the blockage is developing, there are thin vessels in diabetics. There are narrow vessels, diffuse disease, everywhere the disease will be there. We cannot treat properly. So treatment is a real challenge for heart disease patients with diabetes, unlike those who are not having diabetes. And lastly, we come to prevention. How to prevent it? It is better to prevent rather than treat in diabetic heart patients. What you have to do is you have to prevent the progression of the disease. You have to prevent the formation of heart problems by doing regular exercise, diet control, sugar control, and most importantly, cardiac checkup every year for a diabetic patient, especially treadmill and echocardiogram, ECG, lipid profile. When the LDL cholesterol, usually we call it as 130 to 160 is the normal for adult. However, in a diabetic patient, 70 is the normal. Many patients think that my cholesterol is normal. Why should I take tablet? Because your target is 70. So you have to take tablet like statin tablet to reduce cholesterol if you are a diabetic, and aspirin, preferably aspirin to prevent a heart attack in diabetic patients, and regular cardiac checkup, and control sugar, and take medications. These are the important measures to prevent cardiac disease in diabetic patients. Thank you very much.
Indiana, NABH accredited. Empaneled with Medicep and all leading insurances. Indiana Hospital and Heart Institute, Pumpwell, Bangalore.